Hello, good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on psoriasis. Psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, cold, etc. The most common symptom is a rash on the skin, but sometimes the rash involves the nails, joints, etc. as well. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Priyanka Karagaiah joining us from Bangalore, who is a renowned dermatologist and the founder of Riva Skin Clinic, a premier skincare clinic dedicated to providing customized state-of-the-art treatments to clients of all ages. With over 7 years of experience in this field, Dr. Priyanka has established herself as a leading expert in cosmetic dermatology with a passion for enhancing her clients' natural beauty through a variety of innovative techniques and procedures. And as the founder and head of Riva Skin Clinic, Dr. Priyanka brings a wealth of knowledge and expertise to her practice, along with a commitment to providing her clients with personalized care and exceptional results. See, she is dedicated to staying at the forefront of her field, continually researching and developing new techniques and treatments to ensure that her client receives the most advanced and effective care possible. A very warm welcome to you, Dr. Priyanka. It's a pleasure to have you with us.
Thank you for the nice introduction, Sanikta.
Doctor, today we are going to talk or discuss about a very important topic, psoriasis. So, first of all, Doctor, we would like you to tell us what is psoriasis exactly?
Psoriasis is what we call a chronic inflammatory condition. Chronic means it stays for a long time. Like, it can once you get psoriasis, it can stay for years together. And inflammation is something where your skin's immune cells, see, everybody has immune cells in their body. So the immune cells are dysregulated. So normally they stay in a healthy equilibrium with the body's system. Sometimes what happens whenever there is some triggering factors like stress or infection, your immunity can be sometimes increased, sometimes decreased. So this causes a state called inflammation where the immune cells are overactive. So that's why psoriasis happens in the first place. So it's a skin condition which is chronic and it has inflammation. So that's what psoriasis is.
Right. And many times people ask that can psoriasis be cured completely? Can it completely go away? Can I get complete rid of this condition? What's your answer to that, doctor?
So like I said, it is chronic and it is inflammatory. So as long as there are factors which is driving your inflammation, so as long as that may be your lifestyle, that can be stress, that can be alcohol or smoking, psoriasis may not have a permanent cure. Like there will be periods where you may be normal, you may be stress free, and the psoriasis comes down, it is under control, or you've taken medications, you've taken treatment, it is under control. But there are again periods of excessive stress, when there is an increase in psoriasis. So it stays like this for years together. And there's as of now there's no permanent cure in science for psoriasis, but it can be managed.
Right. And doctor, many times we get to hear that psoriasis or those who have dry skin are more prone to psoriasis. Is that correct, or what's the logic behind it?
It is true. The reason you have dry skin is your skin barrier is defective. Usually, it's like your skin is like a single cloth layer which is intact. So, whenever there's a barrier defect, there are minor tears in the cloth, you can assume. So, that allows uh, allergens, or what we call, inflammatory substances from outside, like the pollution, or it can be sun rays, to enter your skin and drive the inflammation. So that's why dry skin people are more prone to develop psoriasis, and vice versa. Psoriasis in turn has dry skin, because the psoriasis rashes will have barrier defect again. So it becomes like a cycle.
Right. And doctor, we always say, especially in medical field, that prevention is better than cure. So any
Yes.
way to prevent psoriasis, or who are at risk, who should take some preventive measures
See,
to
we
not
cannot
have it?
really say who exactly will develop psoriasis. So it may be currently it may be 5 to 10% of the population who are at risk, and the risk factors include excessive stress, exposure to pollution, your lifestyle, like food habits, inflammatory foods, like high sugar content, processed sugar content, oily food, then a lot of red meat. Smoking and alcohol are two important, like very big factors, which can make you prone to develop psoriasis. And these are the few people who can develop psoriasis, and mostly in psoriasis.
Right. And
People, yeah, sorry. There might be people who are taking certain drugs, like you may be taking drugs for BP, high BP, or depression. There are some people who can develop psoriasis because of these drugs. Not everybody, but some people, and certain kind of drugs. Not every medication is
right.
going to give psoriasis. Yeah.
No, but you also say, doctor, that in case you have any kind of infection, be it psoriasis or anything else, you need to go and consult a expert. In this
Yes.
case, of course, it's a qualified dermatologist. But the problem is in our society, because over-the-counter medication is so easily accessible, or we have such firm belief in home remedies. Plus, these days, the market or the social media is flooded with influencers and products, of course. Now, what people normally do in case they have something related to their skin or scalp, they'll first try some home remedies. So they'll keep on applying something, or they'll, take suggestion from an influencer who is there online endorsing a number of products and home remedies, again, quick fixes. Plus, they have the chemist shops so easily accessible. They'll go there and ask for a cream, topical cream, and they'll keep applying it. My question to you, doctor, is that how effective are these home remedies or influencers' advice or over-the-counter medication, or are they harmful?
I have never found a case where they have been effective. So they're definitely harmful. See, home remedies also, there are some which can be safe. They may not provide any benefit as such, but they'll not do any harm also. Like some people apply milk cream, or sometimes coconut oil. See, these are good emollients. These are time tested. They'll not make any difference to your disease, but neither will they harm. But there
Right.
are some things like neem paste, or sometimes turmeric. The store-bought turmeric has a lot of additives in them. Or sometimes they apply lemon, garlic, and these kind of things. They have certain acids which are irritants. So when you're applying it on an already irritated skin, already inflamed skin, this is going to worsen the disease. And so with the chemist bought products. So I've saw you get these support lotion and other things, like very easily available, which they buy in the chemist shops over the counter. These again contain certain irritants which can irritate your skin. Sometimes you may even have some improvement, because nowadays we get a lot of combination products which also has some steroids very readily in the market. So people apply that. For time being, it may give you relief, but it is not really targeting the root cause. So we don't know why it is getting triggered. In case if psoriasis is developed because of an infection, it is going to worsen. And influencers are not really the people you should be looking forward to whenever it comes to any medical advice, because what they say is mostly about the normal skincare, and they just talk about things that have worked for them. And for all you know, they have flawless skin, which is like genetically very good skin, so it really doesn't make any difference to them. So any of the three, if you're taking suggestions from any of these three medias, it is only going to be harmful, especially in conditions like psoriasis, which needs a treatment from the root, which
Right.
can be
And
identified only by a certified or a qualified doctor.
right. And the treatment approach is definitely individualistic. I can assume that it's not generalized, right? So we can't even take help of a friend or family who had, psoriasis once upon a time and who had taken doctor's prescription. Because in our society, this practice is again very common that we'll take their prescription, go ahead and take the medicines and start self-medicating. So I'm sure that also won't work because we don't know what's causing psoriasis in us.
Definitely. In the first place, it may not be psoriasis because a lot of skin diseases look alike in dermatology. And because we are trained to look for certain cues which will tell you exactly what a certain condition is. Psoriasis can look alike with fungal infections. It can look similar to an allergic dermatitis. It can look similar to a lot of things. You need not be having psoriasis also, so it will not really work if you go to any of your relatives or family members who had, and if you're using the same medication, it may not really work for you as well.
Right. So it's always advisable to go and consult a right person, which is a qualified dermatologist. So please don't waste your time, your energy, your money, and most importantly, your health on home remedies or talking to a friend or family or going for over-the-counter medication. They can be really harmful. Please go to the right person at the right time at the very first place, which is a qualified dermatologist. Now, Doctor, yeah, we know that psoriasis, one is definitely the superficial psoriasis of skin, but then psoriasis or psoriatic arthritis is also very common. Psoriasis can spread to nails as well. We would like you to throw some light on these as
See,
well.
skin is the most common and part where you develop psoriasis,
Mm.
mostly on your elbows, knees, mostly areas which are prone to trauma, like elbows, knees, lower back, scalp, and these are the areas where you most commonly develop. And occasionally, along with that, you'll also have nail, which is the next most common nail involvement. You can have some discoloration, like very brittle, crumbly nails, or you'll have certain holes or pits on the nails. So this is how it starts. Very rarely, in about 10% of the people, you can develop arthritis, and arthritis usually starts after years of suffering from psoriasis. Very, very rarely, arthritis is a presenting symptom. And the arthritis is also in bigger joints, like it starts with knees, and then it can involve your small joints of the hands and toes and other things. So most commonly it is the skin, very rarely only joints, but whenever your joints are involved, you will definitely have skin and nail involvement before the joint involvement starts.
That makes it even more important to treat your psoriasis well
Early,
uh,
yes,
through the right
recognize it
channel.
early and
Mhm.
make some lifestyle changes so you don't go there.
Right. Now, when a person comes to you with the symptoms which are similar to psoriasis, what you normally do to diagnose it? Or, I mean, just by clinical investigation, you can tell that, yes, this is psoriasis, or you get some tests done as well.
See, most psoriasis cases are very clear cut. So because we our eyes are trained to recognize it, we can recognize it just by clinical examination. And to confirm, we also do some minor bedside tests with the instruments that we have, like like a glass light test, and we just or a dermoscope. So it gives away the disease. So most cases don't need any tests as such. In some cases where diagnosis is not clear cut, or we are suspecting something else, then we do a biopsy. So it's either clinically or a biopsy. No, blood tests cannot really tell you about much about psoriasis. So blood tests are only reserved for people in whom we want to do any treatment. If we want to put them on any medication orally, then we do a blood test. So it's mostly clinical diagnosis.
Okay. And what are the treatment options available, doctor?
Most cases are pretty mild, like they if your body surface area, like if it's less than 20% of your body surface area, we would like to treat it with topicals. That means creams and lotions only. Because it's a chronic problem, we cannot, and also the medications that is required for psoriasis have their own side effects. We don't like to start a person with any oral medications right away, other than some supplements, of course. Uh, but usually it is with creams which contain a stronger steroid or vitamin D derivatives. There are multiple things. So we start with that with a very and also with a very good moisturizing coverage. Like a thick moisturizer is very important, and we usually start with that. In slightly severe cases, we even start them on phototherapy or light therapy, where a certain wavelength of UVB rays are given because they improve the immunity in the skin and reduce the psoriasis. So this will be our first line. Only in severe cases or if you have severe arthritis, then you will need oral medications. These are anti-inflammatory drugs which are stronger, which needs to be started only after a thorough investigation. Clinically, we do a clinical investigation with blood tests to ensure you don't have any other kidney, liver problems or diabetes or thyroid, and then we start them on these medications till they come to a certain control. Like once it reduces, again we taper those medications and we put them on creams. So this would be the treatment.
Okay, doctor. And doctor, does sun or sunlight help in case of psoriasis?
Yes, definitely. The sunlight has UVB rays, though, although it is not a single wavelength, it's not filtered. It helps in improving the immunity, and also a lot of people with psoriasis are also deficient in vitamin D. So it also helps in improving your vitamin D levels, and to some extent reduces your severity of the lesions. It may not completely help in curing. It will definitely reduce the severity of the lesions.
Right. Is psoriasis contagious? Can anybody get it from someone else?
No, it is not at all contagious. It is usually genetic. So there are chances a person in your family, like your immediate family, your father, mother, or your kids may develop at a certain point. There are slight chances of that, but it is never transferable to other person. Like if you have it, your spouse will not get it, or your friends will not get it. It is not. It is not contagious.
Okay. Which are the areas or body parts that are more, prone of developing psoriasis, doctor?
Most commonly, it is the pressure bearing areas like your elbows, knees, your back, lower back, like the and sacral area, then your scalp. So these are the most common areas, and nails. Occasionally, they can come on the groin area also, and can involve like your entire body. So when the severity is more, it can come anywhere on the body. Okay, and usually face is spared. Sun exposed areas like face and neck are spared, but even sometimes even there you can find if it is severe psoriasis, even face can be affected in that. And
Hmm. But I'm
whenever
sure it grows gradually, right? It won't come
yes,
over the night. Maybe it will start with some small
no.
patch or something.
No, it usually there are some variants which can come overnight, like after staphylococcal throat infection or some infection like a folliculitis kind of infection, you can develop like overnight small lesions all over the body. But there's or if you have severe illness or fever, sometimes it can happen, but usually it's a gradual process. It usually starts like a red rash, then slowly it becomes raised, and then you start seeing this waxy candle like powdery stuff on that. Then it becomes thick. So usually it develops like that. So and then
Mhm.
it starts with one place, and then gradually, if your stress levels still continue in the body, then it will gradually spread to other areas.
Hmm. Now, the thing is, as you also mentioned initially, that most of these, skin-related infections or problems, they are very similar for a layman. I mean, what may be a psoriasis on my skin may look to me as urticaria, case of urticaria or something else, or a fungal infection. And many times, what people do initially, I mean, when they are having it for the first time, they'll go and take an anti-allergen, assuming that it is out of some allergy or things like that. So, what's your advice when we see these patches or lesions? What should we do?
Avoid self-diagnosing, avoid looking for Google for answers, looking at Google for answers, or avoid asking anybody who's not qualified for your answers. If it is one or two, and sometimes it may just be a rash, it may go away. But if you feel like, day by day these things are increasing, and then it's better to always consult a person. It is a one time consultation can definitely tell you what's the diagnosis, what is the prognosis you are looking at, as in like what is the course of this disease, what is the treatment you need to take, what are the steps you need to take to reduce it, what is the possible trigger that is causing it, which you can control to avoid it. So all this can be done in one single consultation when you go at an early stage. And this other things can be avoided. You end up spending you end up spending so much money on trying so many things that so many people have told, but people always hesitate to go for one single consultation. It is going to, in the long run, it is going to save you a lot of money. So that is something that people don't understand, because they keep trying. They try five six things which may have costed them thousands of rupees. Instead, you just spend 500 rupees on a consultation, and it is going to save you a lot of headache and money as well.
Right. That's why we emphasize sizing the fact that we need to go to the right person at the very first place. So, in case you see these lesions, please go and contact a qualified dermatologist. Don't go for quacks or don't fall prey to any other, thing. Just go and consult a qualified dermatologist. That's really beneficial, and you'll end up saving your energy, your time, your money, and most importantly, your health. Doctor, what happens? Because as you said that it's a chronic condition, so the treatment, of course, is quite lengthy. So how much time normally it takes to, cure? And plus, many times people lose the patience and they'll, stick to the prescription for say 1 month, and then they'll lose the patience. Or in case they see some relief, they'll stop using the medication anymore without even informing the doctor. So what's your advice on that?
So usually in 3 to 4 weeks time, you should have some sort of improvement. And after that, it's all about maintenance. We tell them to at least continue the medications twice a week, like, slowly bring it down to twice or once a week. So it is under maintenance. So the maintenance can go on for years. It's not that, it will end within a month or two. So a regular follow-up will be required. Initially, monthly once kind of a follow-up may be required for a couple of times. After that, at least every 3 to 4 months, whether you have it or not, if you can just just visit once, and or whenever you start developing that one single patch, if you visit your doctor again, then they'll be able to help you again. But there is no particular timeline that you can say it will start working. Usually, if it's a minor case, it should start reducing within 3 to 4 weeks with medication, and thereafter you maintain for months together. Okay.
Right. You also said that lifestyle modification or a healthy lifestyle goes a long way in maintaining or
Yes,
preventing
yes.
psoriasis. What can we do in that regard, doctor?
So lifestyle in the sense, stress is a very important factor driving psoriasis. So, and obesity is one other thing. So whenever your body fat percentage is more, it's an inflammatory condition by itself. So that is one thing you have to take care of. So weight loss and cutting down your calories, reducing processed sugar and high fat food, that will reduce the stress or inflammatory condition of your body. Quit alcohol, quit smoking, regular exercise. It can be yoga or like breathing exercise. Anything that relieves your stress will improve your immunity, and also sun exposure. Every day, 5 to 10 minutes of sun exposure that will improve your immunity. And the food you intake, it should be mostly comprising of antioxidants rich food. That means a lot of green leafy vegetables or colored fruits and vegetables. And you can also consult with your doctor and take some omega fatty acid supplements, because these are anti-inflammatory in nature and they'll help you in improving your overall health.
Right. I'll take one question from our viewer. Firoz Khan's question is, what is the long-term outlook for psoriasis management?
Long-term outlook is a good lifestyle. So that is what will maintain it in the long run. Whatever treatment we give is short term and for time being, and you maintain for some time, but a good lifestyle including whatever I said before, just before this. So if you can include all of this, then it will be under control.
Right. Faria Beg is here. Her question is, how can I manage psoriasis flare-ups during different seasons or weather conditions?
Usually psoriasis becomes more in winter seasons. So whenever just before winter approaches, start increasing your moisturizer application, like apply it more frequently, and also that is one thing you can do, and keep your medications handy. So but still sometimes despite all these you may still develop some patches. Just visit your doctor and keep the medications going on at least as a maintenance once or twice a week throughout the winter seasons, so it reduces. Then again, once in summers, it usually tends to come down.
Okay. One last question. Purvi Mehra is here asking, are there any specific skincare products or practices I should adopt to help manage my condition?
There's nothing specific that you can do, because usually skincare is limited to face, neck, hair, and so psoriasis does not really affect your face that much unless you have a severe case. So your skincare for your face and neck can be normal, and for the other body parts, moisturizer is one thing that is very important, and sunscreen if you would like, if you're somebody who goes out very frequently. For your hands and legs, if you want, you can use a sunscreen. There's no other particular skincare regime that you have to follow for psoriasis per se, but use a good moisturizer.
Right. And Dr. Priyanka, before we wind up, any take-home message for our viewers?
Definitely, always consult a dermatologist before you self-treat or treat it for conditions like these, and always maintain a good healthy lifestyle, where try to reduce weight if you're obese, and try to inculcate good dietary practices, and try and exercise at least 4 to 5 times a week, at least for 30 minutes, which is going to make a lot of difference to your overall health.
Right. So we're maintaining a good lifestyle, keep
Yes.
your skin moisturized. That goes a long way in maintaining your skin. And definitely, in case you have any trouble, please go and consult a qualified dermatologist. That's the bottom line. Thank you so very much, Dr. Priyanka Karagaiah, for your valuable time. And it has been a very informative session for our viewers. Thank you so very much.
Thank you so much for inviting me here. It's been a pleasure as well.
Thank you, Doctor. It was great to hear you. And we really look forward for many more such sessions in the coming times with you for our viewers.
Definitely.
Thank you. And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day.